Hello, this is Dr. Tushar Shah. Today is the 18th of July, the 10th day of our program on outpatient management of COVID-19. Today I have a few suggestions on telephonic consultation of COVID-19. The first suggestion is always talk to the patient, not just to the relative. This often happens that the relative calls you and you finish the history with the relative. Never do that. There will be a lot of disparity between what the relative says and the patient, what the patient actually has. The second rule, when the patient starts talking, they often will ramble at the second sentence itself, meaning डॉक्टर साहब मुझे 3 दिन से बुखार है और मैंने 2 दिन से एजिथ्रोमाइसिन ली है, फिर भी stop the patient. Tell them I don't want to listen to azithromycin, not because you hate azithromycin and COVID, but because you want to listen to the story of the patient. Tell them पहले अपनी symptoms के बारे में बताइए. So listen to the symptoms carefully before you go to the investigations or the treatment. Next, always avoid multitasking. When the patient is talking to you, you might be on hands-free. Your hands will be free to do other things like going on the laptop, on WhatsApp, etc. Avoid that. To avoid multitasking, the best method is to close your eyes while listening to the history. वैसे भी हम लोग कहते हैं ना, हम इतने एक्सपर्ट हो गए हैं कोविड में कि वी कैन डायग्नोज विद आवर आइज क्लोज्ड. सो लेट्स डू दैट. You have to open your eyes for the sake of note taking. Always take notes of every patient on your letterhead, on a foolscap paper, whatever you like. Always dissect the history properly. ODP of every symptom symptomatology has to be the crucial part of your history. Don't skip anything. After symptomatology, you will go to the comorbidities, the very important area in COVID. Ask the weight of the patient, because obesity is a comorbidity which the patient may not tell you about. Ask about every medicine that the patient takes, because you might be concerned about, say for example, dual antiplatelet therapy, because the patient will be on Clexane or on steroids and that may lead to bleeding. Ask the family history properly so that you can slot the patients in their rooms. If the patient has had history of fever within the family, and if the person has a mother, for example, has had fever 7 days back which looked like COVID, then you must remember that they both can stay in one room, the patient and the mother. You will then be easily able to isolate correctly. So geographia of the house and the family history of COVID itself would be important. So these are the history taking suggestions. The other suggestion that I have is, after discharge, you must do a video consultation. After discharge, the patient comes home, you must see whether the patient has oral thrush. Oral thrush will be due to antibiotics, due to the steroids for COVID, due to the increase in diabetes that the patient experiences. Oral thrush is a common continuation of dysgeusia or altered taste, which anyway happens in COVID. Similarly, edema, feet, deep vein thrombosis can be picked up on a video consult. So do that. Another important thing is investigations and treatment must be typed and sent, or on a letterhead photographed and sent, not verbally told. Take crocin, take becozing, take Uprise D3. No, you have to write that down and give it to the patient, because misunderstandings can be common. Remember to tell the patient that fasting is not necessary in any investigation related to COVID. Well, so are the so many suggestions here. एक 4 पंक्तियाँ कविता की before I leave. अपने ही टेलीफोन पर कभी अपना नंबर मिलाकर देखा है, अपने ही टेलीफोन पर कभी अपना नंबर मिलाकर देखा है, बिजी टोन मिलेगा, नियमों का लेखा है, औरों से मिलने जुलने में सभी मस्त हैं, खुद से मिलने की सभी लाइनें व्यस्त हैं. Thank you so much.